Welcome, future nurses. In this explainer, we're going to sharpen your knowledge of therapeutic diets for the NCLEX. And listen, this is absolutely must-know content, so let's dive right in and make sure you're ready to nail these questions. Okay, let's kick things off with a classic NCLEX-style scenario. Just imagine, you're on the floor, you're doing your rounds, and your patient on hemodialysis looks up at you and asks for a banana. What do? What's the right call here? We're going to answer that, so just keep that question in the back of your mind. All right, to figure that out, let's open up our first case file, the renal diet. This one is a huge topic on the exam, so you're going to want to pay close attention here. So here's a question you could easily see on your test. The correct answer? It's D, potassium. But the why is what really matters. See, failing kidneys just can't get rid of potassium the way they're supposed to. That leads to hyperkalemia, which is a fancy way of saying there's a dangerous buildup in the blood. And that buildup, it can cause life-threatening cardiac dysrhythmias. So your dietary intervention here is literally life-saving.
The key takeaway here is that the renal diet isn't just about one single nutrient. It's really a multifaceted balancing act. We're carefully restricting protein, phosphorus, potassium, sodium, and fluids, all to ease that massive workload on the kidneys and prevent a toxic buildup of waste.
And here we go. This right here solves our opening mystery. That patient asking for a banana, that is a hard no. A single banana can have over 450 milligrams of potassium. But look at all the other culprits on this list. Things like potatoes, tomatoes, oranges, even dairy. This table is basically your patient education cheat sheet. You have to know these. Okay, let's move on to our next case and see how these concepts build on each other. We're going to tackle nutrition for a patient with diabetes. Now, this one is a little different. It's less about straight-up restriction and a whole lot more about smart management. Here's another super common NCLEX-style question. The best answer is D, a low glycemic index diet. You know, the goal isn't just about the amount of carbs, it's really about the type of carbs. We want our patients to choose foods that release sugar into their bloodstream nice and slow, nice and steady, to prevent those dangerous blood sugar spikes. Now, this is a huge shift in thinking, and it's a key point you need to know for the NCLEX. The modern approach is all about controlling and counting carbs, not just saying no more sugar. A patient can absolutely have some dessert, as long as it's planned for and counted as part of their overall carb allowance for that meal. That's a game changer. And this just illustrates the practical side of it all so well, because you, as the nurse, are going to be teaching this system. Look at this. One slice of bread is about the same carb-wise as one small apple. This exchange system empowers patients. It gives them flexibility and control, which helps them keep their blood sugar stable all day long. Our final case file for today is all about patient safety. This is a fundamental skill you are going to use constantly as a nurse, managing diets for patients with dysphagia, which is just the clinical term for difficulty swallowing. So, what's the number one priority here? It's always preventing aspiration. That's when food or liquid goes down the wrong pipe and into the lungs, which can cause a deadly pneumonia. So we modify the food's texture to make swallowing safer, while still making sure our patient gets the nutrition they need. It is so important you know this progression. Okay, so level 1 is completely pureed, smooth like pudding. Then, as a patient's swallowing improves, we might advance them to level 2, which is mechanically altered, moist and soft. Finally, level 3 is almost a regular diet, but we're still avoiding really hard, sticky, or crunchy foods. Your assessment skills are what determine when it's safe to move a patient from one level to the next. All right, so we've just walked through 3 very different case files, right? So what's the big picture takeaway from all of this? Well, for the NCLEX, you can actually simplify all these different diets into a really clear, easy-to-remember framework. And here it is. This is the simple framework that ties it all together. Just about every therapeutic diet you will ever encounter is built on one or sometimes both of these pillars. So when you see a diet question, just ask yourself, are we restricting a nutrient like we did with potassium, or are we modifying the texture like we did for dysphagia? If you can identify the pillar, I promise you you're halfway to the right answer. Now, we've definitely hit the really high-yield diets, the ones you're almost guaranteed to see on the exam. But it's important to recognize that these are just part of a much bigger nutritional picture. I want you to think of this explainer as your solid foundation. But before you walk into that testing center, you've got to make sure you've also reviewed these other key interventions. Everything from clear and full liquid diets after surgery to the complexities of tube feeding in TPN. Let's wrap up with what is truly the most important point of all. Knowing the what of these diets is one thing, but the NCLEX, it's going to test you on the why. Your role goes so far beyond just delivering a meal tray. It's about critical thinking, it's about assessment, it's about education, and it's about being your patient's biggest advocate. So use the momentum you've got from this explainer right now. Pick one of these diets, maybe the one that you feel the least confident about, and just decide to master it tonight. You are building your knowledge one brick at a time. You can do this.